When it comes to mental health treatment, finding the right medication can make a world of difference. Enter fluphenazine, a powerful antipsychotic medication that has been widely used for decades. But what exactly is fluphenazine and how does it work? In this video, we delve deep into the benefits, uses, side effects, and safety of fluphenazine to provide you with a comprehensive understanding of this medication. What is fluphenazine? Fluphenazine is a medication belonging to the class of drugs known as antipsychotics. It is primarily used to treat psychotic disorders such as schizophrenia and bipolar disorder. Fluphenazine works by affecting certain chemicals in the brain, specifically dopamine receptors, which play a crucial role in regulating mood and behavior. By blocking these receptors, fluphenazine helps to reduce symptoms like hallucinations, delusions, and disorganized thinking. It is available in various forms, including tablets, injections, and long-acting depot injections, allowing for different modes of administration based on individual needs. Despite being an effective treatment option for certain mental health conditions, fluphenazine is not without its potential side effects and safety considerations. It is important to weigh the benefits against the risks and closely monitor any adverse effects while using this medication. Common uses of fluphenazine. Fluphenazine is primarily prescribed for the treatment of schizophrenia, a chronic mental disorder characterized by distorted thinking, hallucinations, and a loss of touch with reality. It can also be used in the management of bipolar disorder, a condition marked by extreme mood swings between mania and depression. Fluphenazine helps to stabilize mood and reduce the severity and frequency of symptoms associated with these disorders. Additionally, fluphenazine may be used off-label for other conditions such as severe anxiety, severe agitation, and certain types of behavioral disturbances. However, it is important to note that the use of fluphenazine for off-label purposes should be under the supervision of a healthcare professional who can carefully assess the risks and benefits. How fluphenazine works in the body. Fluphenazine works by blocking the action of dopamine, a neurotransmitter that plays a crucial role in regulating mood, behavior, and cognition. In individuals with conditions like schizophrenia and bipolar disorder, dopamine levels and receptor activity are often imbalanced, leading to symptoms such as hallucinations, delusions, and disorganized thinking. By blocking the dopamine receptors in the brain, fluphenazine helps to restore the balance of neurotransmitters and alleviate these symptoms. This mechanism of action is what makes fluphenazine effective in managing psychotic disorders. It is important to note that the exact way in which fluphenazine works is not fully understood, and further research is still being conducted to explore its mechanisms in more detail. Potential side effects of fluphenazine. Like any medication, fluphenazine can cause side effects which can vary in severity and frequency from person to person. It is important to be aware of these potential side effects and discuss them with your healthcare provider before starting fluphenazine. Common side effects of fluphenazine may include drowsiness, dizziness, blurred vision, dry mouth, constipation, and weight gain. These side effects are generally mild and may subside as your body adjusts to the medication. However, if they persist or worsen, it is important to inform your healthcare provider. In some cases, fluphenazine can also cause more serious side effects that require immediate medical attention. These may include muscle stiffness, tremors, abnormal movements, fever, rapid heartbeat, difficulty breathing, and changes in blood pressure. These side effects may indicate a rare but serious condition known as neuroleptic malignant syndrome, NMS, and should be reported to your healthcare provider immediately. Safety precautions when taking fluphenazine. Safety is of utmost importance when it comes to any medication, and fluphenazine is no exception. It is essential to follow the prescribed dosage and adhere to the recommended safety precautions to minimize the risks associated with fluphenazine. Here are some important safety considerations to keep in mind. Regular monitoring. Fluphenazine may require regular monitoring of blood pressure, heart rate, and blood tests to ensure that the medication is working effectively and not causing any adverse effects. Avoid alcohol and sedatives. Fluphenazine can enhance the sedative effects of alcohol and other central nervous system depressants. It is important to avoid or limit the consumption of alcohol and discuss the use of other sedatives with your healthcare provider. Heat exposure. Fluphenazine can impair the body's ability to regulate temperature, increasing the risk of heat stroke. It is important to stay hydrated, avoid excessive heat, and seek medical attention if you experience signs of overheating such as high body temperature, rapid breathing, or dizziness. Pregnancy and breastfeeding. The safety of fluphenazine during pregnancy and breastfeeding is not well established. It is important to discuss the potential risks and benefits with your healthcare provider before using fluphenazine if you are pregnant or breastfeeding. Driving and operating machinery. Fluphenazine can cause drowsiness and impair cognitive function. It is important to exercise caution when driving or operating machinery until you know how this medication affects you. Alternatives to fluphenazine. While fluphenazine can be an effective treatment option for certain mental health conditions, it may not be suitable for everyone or may cause intolerable side effects. In such cases, there are alternative medications that can be considered under the guidance of a healthcare professional. Some common alternatives to fluphenazine include other antipsychotic medications such as risperidone, olanzapine, and quetiapine. These medications work through different mechanisms and may have different side effect profiles, so it is important to discuss the options with your healthcare provider to find the most suitable alternative for your specific needs. Fluphenazine dosage and administration. The dosage of fluphenazine can vary depending on the individual, the condition being treated, and the formulation of the medication. It is important to follow the prescribed dosage and administration instructions provided by your healthcare provider. Fluphenazine is available in different forms, including tablets, injections, and long-acting depot injections. The choice of formulation will depend on factors such as the severity of symptoms, the individual's ability to adhere to oral medication, and the preference of the healthcare provider. It is important not to alter the dosage or stop taking fluphenazine without consulting your healthcare provider, as sudden discontinuation can lead to withdrawal symptoms or a relapse of symptoms. Fluphenazine interactions with other medications. Fluphenazine can interact with other medications, including prescription drugs, over-the-counter medications, and herbal supplements. These interactions can affect how fluphenazine works in the body or increase the risk of side effects. It is important to inform your healthcare provider about all the medications and supplements you are taking before starting fluphenazine. They can assess potential interactions and adjust the dosage or recommend alternative medications if necessary. Some common medications that may interact with fluphenazine include certain antibiotics, antifungal medications, antidepressants, antihistamines, and medications that affect heart rhythm. Fluphenazine and mental health conditions. Fluphenazine is primarily used to treat psychotic disorders such as schizophrenia and bipolar disorder. These conditions can significantly impact an individual's quality of life and functioning. Fluphenazine helps to manage and alleviate the symptoms associated with these disorders, allowing individuals to lead more stable and fulfilling lives. However, it is important to note that fluphenazine is not a cure for these conditions and should be used as part of a comprehensive treatment plan that may include therapy, lifestyle changes, and support from healthcare professionals and loved ones. Conclusion: fluphenazine is a powerful antipsychotic medication that can provide significant benefits for individuals with psychotic disorders such as schizophrenia and bipolar disorder. By blocking certain brain receptors, it helps to reduce symptoms like hallucinations, delusions, and disorganized thinking. However, it is important to be aware of the potential side effects and safety considerations associated with fluphenazine. Regular monitoring, adherence to safety precautions, and open communication with your healthcare provider are essential for ensuring the safe and effective use of this medication. Remember, finding the right medication and treatment approach is a collaborative process, and your healthcare provider is there to support you on your journey to better mental health. Thanks for watching.